All right, it's Dr. Shelley and I'm back, and so we are continuing on with our fluid and electrolytes lecture. We've already done electrolytes, that's finished. Now we're doing fluids. So you again are in this packet and you are looking for a page that looks like this. It's towards the back. You have quite a few pages that are going to apply to this part of the actual lecture. If you are my NCLEX students, then you would need to also get your procedures packet out. And the procedures packet, of course, looks just like this. And I want you to go ahead, and what color is it, everybody? It's pink, so it's on the test, right? Everything pink is on the test. Don't worry if you have the book. Just so you know, the book also has the handy dandy nifty procedures packet in here. And everybody, again, they love the book because it has everything you ever needed in the book. Everything pink is in the book. So with procedures, you want to turn to page 3 and 4 is where we're going to be at. Okay, so it starts off and it says peripheral vascular access. You want to be careful with this because on the actual exam, they will not say IV. They'll say peripheral vascular access device or catheter. It actually starts back here with some tips on how to start the IV and some important procedural things, but that's not why we're here. We're not doing a procedures lecture, but this is where you need to kind of hang out a little bit, because as you can see in the procedures packet, if again you're my NCLEX student, you will see the isotonic and all that good stuff. You will also see infiltration and phlebitis. You will see the central lines and the midlines, and we're going to talk about that today, okay? Now, so as we get started, if you look at my board and you are taking notes with notebook paper, that's actually fine for this part of the board. If you are my NCLEX student, this is already written for you. You just need to kind of follow along and kind of highlight all the way through. So the typical IV fluids that a nurse is going to hang are always going to be called crystalloid fluids. You know they're crystalloid because you can see straight through them. They're clear bags of fluid. The examples of crystalloid solutions, if you will, are hypotonic, hypertonic, and isotonic solutions. Now, if we remember the golden rule of any patient with an IV, we must check the IV site every hour. And I do want to make a special note about checking that IV site and paying really close attention if there's any oozing at the IV site. A good nurse can kind of pick up on platelets dropping with oozing at the IV site. It's like the first sign of perhaps some bleeding problems or platelets dropping. Now, that being said, let's kind of dive into this particular issue with these fluids. Again, we're talking crystalloid solutions. The first of which I've drawn a, and I'm not an artist, so don't laugh, but I've drawn a hippopotamus. Because what I want you to say to yourself is that when I take my test and they talk about hypotonic solutions, I want to remember it's just like a hippo. It's going to make my cells really, really fat. So here's some specific language you have to know. The patient that has hypotonic IV solutions hanging is going to have a situation where we are moving the extracellular fluid right into the actual cell. So we're making the cell very, very, very big because we're pushing fluid into the cell whenever we hang hypotonic solutions. What do we treat with this type of IV solution? We treat fluid volume deficit. You know that that's like severe dehydration or something like that. So we're causing, again, the fluid to move into the cells. We are making the cells fat, hippo cells when we're done. Now I gotta tell you, This is kind of easy. If you think of hypo always meaning low, you kind of got to know that this applies as well, but you got to start at normal to know where low is. Let's start with normal. Normal is like isotonic, right? So watch this. Normal IV fluid solution is typically 0.9 normal saline. I think everybody agrees. Well, this is hypotonic, so it's going to take that 0.9 and go down. And here's some examples. And I kind of wrote it in a weird way so you could flow with your girl. 22, 33, 44, but really 45. So here we go. 0.225 sodium chloride, less than 0.9. So it's going to take that 0.9 and go down. And here's some examples. And I kind of wrote it I threw D5W here because when it's in the actual bag, it is hypotonic. When it gets to the body, it's usually isotonic. But I threw it up there for a bigger reason. I need you to write at the top of this page, never bolus the D. Now, I know she loves the D, but you're never going to bolus the D. In other words, if there's any solutions that are going to contain sugar, you will know it because the D stands for dextrose. You can never bolus dextrose. You can't open that IV wide. You will be very sorry. You probably won't practice anymore. Your license will be in the toilet. You get it. Okay, so never bolus D5 anything, right? D10, D nothing. No bolusing of the D. All right. Now, so that's your hypotonic solutions. And I just got to tell you, working for 30 some odd years, yeah, no, I don't really hang any hypotonic solutions very often. They're kind of rare, but they show up on a test. That does not negate the fact that they're going to show up on that test, right? You never know. You could be tested on this. It's kind of common. But it's never really used in the real field by most nurses. So as a nurse, don't go looking for this because you're probably going to not find it, okay? Now, let's move on to the hypertonic solutions. Hypertonic solutions, think of hyperactive people. If you're aware of what happens to hyperactive people, and I would know because I had Graves' disease, so I was like, woo, all hyper and crazy. Thank God for treatment. But if you know someone that's hyper, they get very skinny because hyperactive people are working off their body fat, right? I wish I had that problem, but you know, like I said, I was treated, so no, I'm not skinny anymore. But hyperactive is skinny. It takes that big old cell that was created in the hypotonic solution, and it actually does the opposite. It takes it and it shrinks it down and pulls all that fluid right off. Now think this through. Who in God's name would want fluid pulled off the patient? I do if there's fluid on the brain, like cerebral edema, like SIADH. I do if my patient is floating around like a water balloon because they're so edematous, and that would be the patient with any kind of edema. Okay, so these are things that we pretty much know this fluid would be good for. So if you look at it, it treats what? Neuro patients. In particular, when I say neuro patients, I'm talking about a high intracranial pressure. I'm talking about a brain injury. I'm talking about a patient that has some type of stroke. I'm talking about all of that. Now, if you look, neuro, and then there's that doggone word again, syndrome of inappropriate antidiuretic hormone, and again, that SIADH is so popular. What else is it for? It's for third spacing. Remember this, we had 3 spaces. Let's review. We had space number 1, that was intracellular fluid. had space number 2, that was extracellular fluid. And then we had space number 3, which wasn't supposed to be having all that much fluid, and that was called the interstitial area. So the interstitial component, which that's all spelled goofy, huh? So interstitial component is called, you remember, in the tissue. Okay? So what did we say? We said interstitial in the tissue. Interstitial in the tissue. Boom, 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 boom. 1, 2, 3rd space. If there is fluid in the interstitial space, that's called edema. You're going to find out later that it will be called infiltration when we talk IVs and your IV went crazy. But for now, it's literally called 3rd spacing. You have fluid in a space that you shouldn't have. Now, this is called a fluid volume excess. So what's going on? Well, when you hang this IV solution, you cause fluid to move from the intercellular fluid. You cause the fluid movement from intracellular fluid to extracellular fluid, creating a skinny cell because you took the fluid right out of the cell. Examples of this include 3% sodium chloride, D10W, D5LR, D5.5 normal saline. A lot of D's in there, people. Dialysis, there's another D, she loves the D. You have your mannitol, which treats ICP, high intracranial pressure. Remember, it's called an osmotic diuretic. It's going to make the patient pee it off. Now, we know that this type of fluid, if you give it to the patient, it's going to pull fluid out of the cell, make the cell skinny, get rid of it through the kidneys, and their blood pressure will also come down. So that's kind of nice. And that's a beautiful thing if you have a neuro patient. Now, the last type of fluid, isotonic. What kind of fluid is this? Perfect, perfect. Normal size cell, not big, not skinny, just normal, because there's no change in what? Osmolarity. There is no movement between the extracellular component or the intracellular component. So we want to give this fluid whenever the patient is basically losing blood or something like that, at risk for losing blood. So look at this. It has the same osmolarity. Don't let that word scare you. What did I tell you it meant? Concentration as blood. Same concentration as blood. It's used in every department where blood might be lost. The emergency room, the operating room, the labor and delivery unit, trauma victims, hemorrhaging patients. Everywhere you might lose blood, that's where these fluids will be. What examples do we have? We have 0.9 normal saline. Everybody knows that's just plain old-fashioned normal saline. We have lactated ringers. I think what's really hard for students to remember are the electrolytes that are contained in LR: sodium, calcium, potassium, and chloride. This makes this solution great to use for healthy people. Maybe not the best to use in unhealthy people that could have electrolyte imbalances. My example for you is that you would never use lactated ringers, also called Ringer's lactate. You would never use this solution with DKA or liver disease patients like cirrhosis. But I absolutely use this fluid every day of my career with my maternity patients, so in labor and delivery. I have used this type of fluid solution with surgical patients that are healthy, like the mommy having a C-section. It makes sense, she's healthy. Okay, so this whole electrolyte thing might help her out a little bit because she doesn't have an electrolyte imbalance. The other thing is never use the normal saline, only one reason, never use normal saline if calcium is low. That would not be a good use of this solution. And I gotta tell you, if you're on a test and you're kind of thinking, oh my God, I forgot what she said, don't use this and don't use that and don't use this and don't use that, then just roll with your normal saline, because 99 times out of 100, it's the only one to use. It's the only one that's compatible with dilantin. It's the only solution you can hang when you're giving blood. So just choose your normal saline if you need an isotonic solution, and don't worry about, you know, which one did she say did what, because it's a little bit better to err on the side of choosing that normal saline than it would be to err on the side of choosing lactated ringers. And again, my bottom line is that your lactated ringers or your ringers lactate contains electrolytes. So if a patient could have an electrolyte imbalance, it's probably not a good solution to choose. Now, as we look at all of these solutions, what is very important is for you to notice on this handout, there's all the things I just discussed. So if you look at your handout, in particular at these fluids, you will see that the first bag over to, let me get these things a little bit straighter. This little video might be 25 minutes the way I'm going, geez. But if you look at this bag, that is your sodium chloride or your normal saline. It is the safest solution. It is isotonic. If you look at the handout, it says I'm used to expand volume and even to keep the vein open. Then if you look at lactated ringers, this is important. I mentioned the maternity patient and the OR patient, a healthy OR patient. Why don't you do me a favor and add burns, because it says I'm commonly used for fluid resuscitation. So the burn patient gets lactated ringers. That I have seen before. Let's just say I've seen it before on some tests, okay? Now, what I want you to write as you go a little bit further down, it says, well, not write, but highlight. These fluids are isotonic, same osmolarity as bodily fluids. If you go down a little bit further, you will find that this big bubble right here goes to this guy. Put hypertonic right here, because look at what it says. I'm used for sodium and volume replacement. Caution, go slow, monitor that blood pressure. And then you go down here, and this is D5.5 normal saline, D5 normal saline. This is hypertonic. You know what you better write in that little section? 3% sodium chloride, huge. Write SIADH, okay? This one then is hypotonic. I don't care that you know this at all. I just want you to remember to put your 0.225, 0.33, and 0.45. And remember hippopotamus, okay? Then down at the bottom, it says, don't give D5W to infants or patients with a head injury. It may cause cerebral edema. Yeah, because you're going to push fluid. You're going to push fluid into that cell and make it super freaking fat, and that would be ridiculous. Now, I did make some pretty colors on my page, and I want you to add one last thing. Here's all the pretty colors I made. Here's the last thing. Colloids are solutions you cannot see through. They include blood, albumin, and dextran, and hetastarch. You have to know this. It increases the intravascular space without causing fluid volume excess. Now, you have to remember what the purpose of albumin was. It was to keep fluid inside the vessel, intravascular. When a patient needs a lot of support for their blood pressure, these are the things we're going to use. Now, I hope I've been clear, and now I'm going to come back a little later. You're going to grab a donut and go pee, okay? I'll be back.